And this is my disclosure that I am a paid advisor to Pure Encapsulations. And here are the skills that we want to work on. So number one, lab interpretation ability. Number two, probably even more important in some ways, is the lifestyle coaching and the patient motivation. Because it is very common and very sad to see a well-designed supplement program that is left undone, right? The doctor designs it, but the patient doesn't do it. So we don't want to have that happen. We want to make sure that every program that you design is embraced enthusiastically by your patients so they actually do it. And in order to have that happen, there has to be a huge amount of motivation on the patient's part to bring all this together. And then we can also, when we look at the labs a little more later in the talk about the patient perspective and how you can guide patient presentations to make all this work, right? So today I'm going to talk about two different clinical models. And I think one of the greatest things about functional medicine is its biggest weakness, which is that we learn as we study the body that it's systems oriented, that one system affects the other system. And so as you begin to study functional medicine in the first 5 or 10 years, and you see all these systems interacting, it's very difficult to create a coherent treatment plan for someone because you're not sure where to start. A lot of people start with the gut, which is usually a big mistake. And it's really just, it's like the more that you learn, the harder it is to put it all together. And so one of the things that I'm a really strong proponent of is having a clear clinical model, and a clinical model that you believe in to be true, a philosophy or model that you believe in to be true, and one that patients can understand. Most functional medicine practitioners don't have this. If you just sat down with them and said, what's your philosophy of functional medicine? Why do you think people get sick, and how do you get them better? And tell me in about 2 minutes. They wouldn't be able to do it. They could tell you in 2 or 3 hours what they think, but not in 2 minutes. So we want you to have a 2-minute explanation, because you can't spend 2 or 3 hours with every patient explaining to them why you think people get sick and what makes them better. Okay, so, and I'm going to show you a couple of simple models today that you guys can use right away. They're very effective. I use these in my mentorship training programs all the time. We've used these with thousands of doctors, and they work. Okay, the model has to explain the reasons why you want the person to run the lab test, because this is all lab based. And so the first thing you have to do is make sure that people get the labs done. So the model has to encompass the labs themselves, for sure. And then you have to be able to explain what the tests mean. Once the test results come back, you have to explain them. And then it would be convenient if the test results also fit into the same basic model that we're talking about. So it's a structure, and it's really a patient education structure. It's a process that gives the patient sort of definition around what you're trying to do here, so that you don't sit there and just say, well, everything causes everything and the body's all connected. There's a clear 1, 2, 3 series of steps. And once you get that done, then you're going to figure out what the supplements are that they need, and we'll talk about that later when we look at some of the labs. And you can focus on some lab interpretation skills. And then the last thing that you need to figure out, and again, I know this is a lot to deal with because it's complicated, is how you can connect the test results to lifestyle changes. So a large percentage of functional medicine is based on lifestyle change. And if we're not able to create these lifestyle changes, then we're not going to really get too far. And one of the more powerful aspects of the labs, one of the things they're really extremely good at, is getting people motivated to make lifestyle changes. So I'll show you with each step of these clinical models, what are the associated lifestyle change that you can use. So you have, again, a framework. The lab report says this, I gave these supplements and this lifestyle change. This other patient has a lab report that says that, I gave these supplements and this lifestyle change. So you start to systematize this work, and in a way that's going to get you the maximum clinical benefits. It's going to make the patients feel the best that you can do with a relatively easy to implement program. And so these are the clear, so let me just review this one more time. Number one, having a clear model that you believe in, that patients can understand, that you can explain. And that's going to include why you want them to test, and then being able to explain what the tests mean and how to connect the tests back to the lifestyle changes. Those are the sort of the big picture goals that we have. Um, Not for today's webinar. This is the big picture goals that I would have for somebody after like 2 or 3 years of training. But these are the components. If you can put all these component parts together, then you're going to be super successful. Okay, so now we're going to talk a little bit about GI problems and these different stages of GI disruption or GI dysfunction. And then we're going to talk about the adrenal portion of it. And then we're going to look at labs for both the adrenals and GI and show you how you can put together comprehensive programs, right? That's the goal. So we're going to start off with the GI part. Almost half of the people in the world have functional GI disorders. It's a nice little study on that, and that's cited there if you want to take a look. So anyways, it's a large group of people. It's probably the majority of patients that we work with. Maybe it's 40% of the world. It's probably 90% of my world in terms of patients that come into the office. And those include heartburn, reflux, nausea, IBS, bloating, distension, constipation, diarrhea, all these kinds of enzyme problems, gallbladder problems. It's a pretty long list. And why is this happening to so many people? And why is this, and how does this sort of, how would you say it, like, how does this sort of echo out, or how does this spread out to other issues in the body? So we know naturopaths have espoused this for many, many hundreds of years. And now current scientific research also shows that the gut is the center of immune function. The gut is the center of, and to a large extent controls brain function. The gut helps control even the cardiovascular system. The gut has a really large regulatory mechanism by which it can even regulate your metabolism and whether you're going to gain weight or lose weight, or what's going to happen to the food that you eat in terms of how you're going to turn it into energy. So the gut turns out to be a centerpiece in all these different body systems. And one of the connections that we see the most strongly that's easy to apply from a clinical standpoint is that the gut and the adrenal hormones, or the stress hormones, are very deeply tied together. And so with functional GI disorders, you can have, and you see this in the quote here, altered mucosal and immune function. Altered mucosal and immune function. That means the mucosal lining of the gut can become damaged, and the immune response, which is perhaps 60% of the immune system is in the gut, the immune response of the gut can become damaged. And you can see altered mucosa, or sometimes it's called leaky gut, damage to the gut lining, and immune function problems in the gut that's measured by something called secretory IgA. You can see altered mucosal and immune function on these labs. And in a few minutes, we'll look at a few of them and I'll show you, hey, there's leaky gut. That's altered gut mucosal function. Hey, there's high secretory or low secretory IgA. That's altered immune function. And if you have leaky gut or altered immune function in the gut, you know that there's going to be a problem with the microbiome or microbiota. So microbiome and microbiota, those two terms are used kind of interchangeably. I like the term microbiome more, but sometimes if you're reading a scientific paper, you might see microbiota. I think most patients are more familiar, at least in the United States, are more familiar with the term microbiome. So I know there's technical differences between them. You can look that up if you don't already know that, but I like the term microbiome a little more, but they're interchangeable, okay? And all this then can relate to altered central nervous system processing. So within the stages of the gut, 3 different stages. And this again is a structure that we've made in the functional medicine training programs that I teach so that we can use this as an educational model for patients. And they are stage 1 to do with the microbiome, stage 2 to do with GI organs, and stage 3 to do with GI pathogens. So we're going to go through each one of these stages and then get into the details of them. So number 1, this process starts with what I call a stage 1, which is a microbiome disruption, tissue damage, and inflammation in the gut. That can come from a variety of sources. It can be just simply because the person has a poor quality diet. It can be because they have food allergies or food sensitivities. It easily can happen if you're under enough stress. It can happen if you're not sleeping enough, if your relationships are causing a lot of stress. And typically with relationships, it might be somebody that's had a death in the family recently, perhaps, or they're going through a divorce or some kind of relationship challenge, or maybe they have a child that has, an illness or something like that. But major relationship stress will cause this for sure. You can have it because of environmental toxin exposure, and you can certainly have it from excessive exercise or from a complete lack of exercise. So all these different things that we do in our lives, whether we exercise well, eat well, get enough rest or sleep, whether we pray, whether we meditate, whether we get enough downtime, whether we have enough connection with our family and loved ones, all these things, when they get thrown out of balance, can start to disrupt the microbiome. And when we get to the adrenal portion of the lecture, I'll show you the mechanisms by which that happens, because all these things on this list throw off your cortisol and DHEA. That's what happens. The HPA axis is disrupted by a bad diet, food sensitivity, sleep, stress problems, relationship problems, too much or too little exercise. And as the HPA axis or the adrenals get thrown off of balance and cortisol goes up, your body starts to cause the gut lining to break down, because when you become stressed, you become catabolic. That's the very definition of stress physiology, is you have high cortisol, so you're breaking down a lot of tissues, you're catabolic. And the easiest tissue in the body to break down would be the gut lining or muscle tissue. So we start to use gut lining for fuel, and that causes this process called leaky gut. So leaky gut can be caused by stress from any of these variables. At the same time, cortisol, when it's abnormal due to stress, causes a problem with secretory IgA that I mentioned earlier. That's the immune response in the gut. So now you've got a weakened immune response in the gut because you're stressed, and a leaky gut. And that's what starts to throw off the microbiome. So there again, we're seeing this tie-in between the adrenals and stress and gut function. The microbiome itself is that it's a kind of a global concept, but it's a concept of the totality of the organisms, the good organisms or healthy or commensal organisms that occupy the intestinal tract lining. They're inside the gut, right? But most of the time when people are talking about, they're thinking about the large intestine, although obviously there's a lot of bacteria in the small intestine too. Small intestinal bacteria can be a problem. That's something that we call SIBO, or small intestinal bacterial overgrowth. I'm not really talking about that today. Mostly what we're talking about with the microbiome is going to be large intestine commensal bacteria that are disrupted. And when we look at the labs, we're testing the microbiome. You can measure whether it's intact or not. It's all lab-based. So a stage 1, again, can be disrupted because of diet. And, I don't know how it is in the Philippines, but in the United States, people just have every diet you can imagine. I mean, we have half this country only eats meat every day, and the other half is vegan or vegetarian. And some people don't eat gluten. And some people, it's just incredible. The number of diets in the United States that people are trying at any one time is just mind blowing. And of course, there's so many different diets because nobody's very healthy and everyone's trying to figure out exactly what to do. One of the fads in the United States right now is that beans, and the beans are relatively innocent food, like black beans, pinto beans, garbanzo beans, soybeans. Beans are considered unhealthy by a large group of people because of lectins. And so there's all kinds of crazy conspiracy theories that are going on in the United States right now around food. But there are, thankfully, scientists who have studied this for a long period of time, and it's very clear what are the foods that are good for your microbiome. There's no ambiguity about that. So regardless of whether the person is a meat eater or a vegan, or they hate beans, or they have some problem with any kind of specific food, it's clear that in order for the microbiome to function, you have to have polyphenols and fiber in your diet. And you can't have too much of a reliance upon meat or animal products. I mean, it's fine if you eat some of those foods, but you have to have vegetables, fruits, and legumes to get the polyphenols and the fiber that you need. You can also have a microbiome disruption because of sleep. And again, if your sleep is thrown off, your cortisol is thrown off, abnormal cortisol causes problems with secretory IgA. So now the immune response in the gut is not working well. So that allows bad organisms to grow. They cause inflammation. Similarly, lack of sleep causes abnormal cortisol. Now you're catabolic. So your tissues are being broken down in the gut. Now you've got leaky gut and the inflammation that's associated with that. So another way of saying that, I guess, is stress is inflammatory. Stress is inflammatory. A lack of sleep, it creates an inflammatory process, and that's going to damage the microbiome. In fact, this is a nice study here. Chronic sleep disruption alters gut microbiota, induces systemic and adipose tissue inflammation. Okay, so again, inflammation. Cortisol is an anti-inflammatory hormone, right? When cortisol is abnormal, we become inflamed. And insulin resistance in mice. Now, this is mice, but they're extrapolating to humans, obviously. So systemic inflammation and insulin resistance, that's the very definition of a cortisol problem, because cortisol, the adrenal hormone, is a glucocorticosteroid. It's regulating our blood sugar, amongst other jobs. And cortisol, as a glucocorticosteroid, is also a very powerful anti-inflammatory. Okay, so when you see here, again, systemic inflammation and insulin resistance, that's exactly what the adrenals are helping us control for. So if you want to fix the microbiome, you want to fix the insulin resistance, you want to fix the inflammation. That's why we couple together the adrenal programs with the gut programs. Okay. All right. And then, of course, stress. We keep talking about stress and stress and stress, but chronic stress is going to promote gut problems. I think we all know this intuitively. Everyone has had an experience where they got really stressed and they had a gut problem. I think that one's kind of obvious, but there is a lot of research on this area, in this area as well. Now, all these things that we're talking about, sleep, diet, stress, are the lifestyle factors. So when we're actually designing a program, a supplement program, we're going to test and correct the adrenals, and that test and that correction is going to include lifestyle changes, diet, exercise, and sleep, improving those patterns. And that's going to have a direct improvement on the gut. And then we're also going to analyze the gut with the lab and correct it as well. So the healthier that the lifestyle is, the more resilient and diverse and healthy the microbiome is. And the more unhealthy the lifestyle, sleep, exercise, and diet, the more disturbed the microbiome and the more inflamed they are. And believe it or not, you can have microbiome inflammation that directly leads to metabolic syndrome. It's amazing what these bacteria can do, for good or for bad. So that was stage 1, microbiome for the gut. Stage 2, we look at the GI organs, and then you see here stage 3, we look at infection. So again, stage 1 was microbiome. Now we're talking about stage 2. Over time, if your microbiome is in a state of disarray, and this goes on, then there's going to be changes in the microbiome, this creation of inflammation that we talked about, and that's going to start to impact GI organs. This can result in stomach problems where the stomach's not making enough stomach acid or HCl. This can result in pancreatic enzyme secretion problems. You'll see that on the labs. I'll show you that in a moment. This will result in decreased bile production by the gallbladder. If you don't make enough bile, you can't break down fat in your gut very well. And bile in the small intestine, when it's released appropriately, kills bad bacteria. So you can have SIBO, or small intestinal bacterial overgrowth, as an outgrowth or a consequence of having problems with bile production. The gut will also become leaky, and as we mentioned earlier, you can have problems with the immune markers. So when we're looking at organ dysfunction, we're really thinking about the pancreas, the stomach, the gallbladder, and the intestinal tract. Is the gut inflamed or leaky? Can the gallbladder make bile? Can the pancreas make enzymes? And can the stomach make hydrochloric acid? So in what I call a stage 2, now it's not just the gut bacteria that are involved. Now the actual organs of the digestive tract are not working well. And we'll see this with various lab markers on the test. That was what we call stage 2. And there's some research studies that quote some of these things. So there's a simple solution. If there's a pancreatic problem, you can give the person pancreatic enzymes. If there's a bile problem, you can give them liver and gallbladder support. If there's an immune or inflammatory problem, you can give them anti-inflammatory products, or you can give them leaky gut repair products. So you have potential solutions for each one of these problems in the supplement programs that we use. So stage 1, microbiome. Stage 2 is there's an organ problem. Now, if it goes on even longer, the organs haven't been working for a while quite properly, there can then be a problem with a pathogen or some kind of an infection. So the infection could be parasitic infection, a yeast or fungal overgrowth, or something that we call dysbiosis, which is an imbalance in the good and bad bacteria in the gut. So stage 1, microbiome, stage 2, GI organs, and stage 3, this is progressive, of course. The worst thing that can happen really is that you would then pick up some kind of digestive tract infection. And in fact, when we look at these labs all day long, right? So I have this mentorship program that I teach every week. I teach hours and hours of classes to doctors, and we just review their labs from their patient practice. And I would say, honestly, 90% of the labs have GI infections on them. People are just stressed out of their minds right now. And that's weakening the immune response, weakening the microbiome, weakening the gut organs, and people have these gut infections that are really quite damaging. Dysbiosis, perhaps the most common of all these. Dysbiosis used to be a term that was sort of reserved just for integrative and natural medicine practitioners. Now dysbiosis has entered into the more conventional scientific literature as a term as well, which is great. It's something that we've been working with for 30 years in my practice, and now finally it's accepted in the more conventional practices as well. So now there's feedback loops also, which means if you have a problem with the microbiome that triggers an organ problem, and now you have, let's say, 3 infections in your gut, those infections are going to further disrupt the organs and further disrupt the microbiome. A problem with the gallbladder is going to disrupt the microbiome even more. A problem with inflammation in the intestinal tract is going to further interfere with the microbiome. So these feedback systems are constant. And for most patients, you're going to see all 3 of these things, a stage 1 and a stage 2 and a stage 3 present. And then the question is going to become, well, which one am I going to treat first? Where am I going to really make the biggest difference for this person in terms of impacting their overall health? Now, how to recognize patients with functional GI disorders? Well, sometimes people will tell you, sometimes they won't. So in other words, sometimes people will just say, I have, digestive problems, and they'll tell you what they are. You'll go, oh, okay, well, this sounds like a functional GI disorder. But the trickiest part, this is the hardest thing, in all of functional medicine, I think this concept I'm about to explain is the most difficult. And I was at a conference in Arizona, and this is like at least 10 years ago. And there's a group of doctors in the room, maybe like 50 doctors, and I was doing a talk, a GI talk. And I started off the talk by saying, how many people in the room believe that gut problems, microbiome problems are at the root of many, many different health conditions, such as neurological problems, metabolic problems, autoimmune problems, thyroid problems, it's a long list. And everybody put their hand up because everybody believes that in functional medicine, because we see and we know, from the research and from our clinical experience that that's true. And then I asked, how many people in the room run a GI test on every single patient, every single new patient in their practice? And there's like 4 people put their hands up, and they were all in the back of the room, and they were all people that had taken my class. So they were kind of cheating. So we don't act according to our beliefs in this way. We say that we think that the microbiome can cause a neurological problem or an autoimmune problem. But when an autoimmune patient walks in and they have no gut symptoms, most doctors won't order a gut test. So we want to you're going to miss most of the gut problems if you only test people with gut symptoms, because there's a lot of patients that have functional GI disorders, infections, microbiome imbalances, dysbiosis, all these different things. that don't have any GI symptoms at all. And again, it takes a year or two to get this ingrained in practitioners when we're working with them in our mentorship program. It's very counterintuitive. In any other situation, you would not believe this. So, for example, if I went in to see my regular doctor and I said, gosh, I've got a skin problem on my elbow and it's really bad and it's been bleeding every day and I don't know what to do. So I tell my doctor that. And then my doctor says, well, okay, we're going to do an MRI of your knee. And I'd be like, no, that's crazy. I'm going to go find another doctor. Why do you want to take an MRI of my knee? Because I have an elbow problem. It doesn't make any sense. So we're all conditioned to saying, I have an elbow problem. Let's look at my elbow. I don't want you looking at my knee because I have an elbow problem. And that's how all of regular medicine is set up. And that's how our brains are set up. And so it's very difficult to get doctors to run a GI test on every single patient if there's no GI symptoms at all. It's almost as crazy sounding as running an MRI for, if I said, I want you to run MRIs for everybody's knees, no matter what their problems are. But the bottom line is most of the patients that have GI problems don't have any GI symptoms. Most of the patients that have outrageous and severe GI problems have no GI symptoms. So you can't base whether you test or not on whether they have symptoms because you're going to miss everybody. So this is an advanced concept perhaps, but if you spend a year running a GI test on every single patient, you will do that for the rest of your career. The doctor that trained me, Dr. Bill Timmons, before you could see the doctor in his clinic, this is 30 years ago, and I still remember this very clearly. Before you could talk to Dr. Timmons as a new patient, you had to do a GI test and an adrenal test. That was the requirement before he would even let you come in the office, because he wanted to know the status of the gut and the microbiome and the adrenals on every single patient. So it's very, very important. You can't just recognize patients with GI disorders based on symptoms. Again, probably one of the more difficult concepts to get communicated to doctors. All right, so how do we support GI health? Lifestyle changes, obviously, is a big one. So we often use the elimination diet. You may use other diets, but that's a common one that's easy to do. Making sure that you're doing exercise programs appropriately, getting enough sleep into the person's life, so coaching them about sleep, doing stress reduction, stress management. There's breathing exercises we use frequently. Whatever it is, relationships-wise, I'm not a counselor or a therapist, but we often refer people to a grief counselor if someone in their family just died, or to a marriage counselor if they're struggling with their relationships, those kinds of things. And then detox, we definitely want to emphasize elimination of alcohol, caffeine, and sugar as part of an overall lifestyle program. I like the cereal bowl diet. This works well in the US. I don't know if this is like a Philippines thing, because everybody here likes to eat cereal, which is a little strange, but everyone in the US eats breakfast cereal. So everyone has a cereal bowl in their house. So we want people, for one, just if the only thing that they do in the beginning month or so of treatment, lifestyle change wise, is eat a cereal bowl full of vegetables with every meal first before you eat any other food. It can be raw vegetables. We call that a salad. It could be cooked vegetables. It really doesn't matter that much. We want people to eat a cereal bowl full of vegetables with each meal to start to get the fiber and the polyphenols that they're going to need to help their microbiome be healthy. And then, of course, breathing exercises and making sure people are hydrated. But idea being that we want to make sure that we do lifestyle coaching as well. Now, protocols to support GI health. So we'll look at some actual programs in a minute and when we look at the labs. But when we're thinking about protocols, you want to think about what's realistic for the patient to do. And that's going to depend on the symptoms they have, on how much experience that you have, on how sick the patient is, how much money that they can spend, what they prefer to do, how quickly they want the program to go, how much time you have. So there's a lot of variables here that come into the designing of a program. And as I mentioned in the very beginning, it's very sad to see a perfectly designed program based on labs that the patient won't do. So we want to really have to make sure that it works for the individual patient. So number one, we're going to look at the lab results and figure out how we're going to get control of their symptoms based on the labs. That's the first one. Number two, practitioner experience. If you have a lot of experience doing this, you can get away with doing a lot of different programs simultaneously. If they're new to this, you can start with one program at a time. And the newer you are to this, the more important it is to have a model that you can use to explain to patients. Now, in terms of severity of patient symptoms, I strongly recommend that you start, if you haven't done this for years, with easier patients. Most practitioners start with very difficult patients. And if you start with your most difficult patient, right on your first, 2 or 3 cases, it's likely it's not going to work because you don't have enough experience yet to really handle the hard patients. So start with simple patients in the beginning, easy patients in the beginning. It makes a big difference and make it easier for you to be successful. You then want to figure out the cost. If people don't have enough money to buy all the supplements that we're recommending, then we focus more on lifestyle changes. And then there's patient preference. So some patients prefer to do multiple programs simultaneously. Some people want to use everything all at the same time. Some people are in a huge rush and they want to get everything done. And other people want to do things gradually over time. So once you get all this sorted out and you have a good sense of what the patient's looking for and you've done some interpretation of the labs, then you can start to put it all together into an integrated program where you have the lifestyle choices, you have the gut supplement protocols based on the labs, and you kind of map that together, you wrap that together into an integrated program, right? So now you've got a gut protocol, and let's say the person's got a yeast overgrowth, that's the pathogen, and they've got a gallbladder problem, that's the organ issue, and their microbiome is out of balance. And you start to design a supplement program and lifestyle program for the gut part. Then we want to start to think about the stress component to all of this. And they're connected, as I mentioned, in several different ways. So the stress component, there's seen and unseen stressors. The seen stressors are things that you can just ask people about. Again, grief and loss. It could be a good stress. It could be that someone just won the Nobel Prize, but that's still a stress. It could be that someone just had a baby, which is a wonderful thing, but that could be the stress. So emotional stress doesn't have to all be bad necessarily. There's dietary stress that has mostly to do with blood sugar control, problems with gluten or food allergies and overeating. And then there can be pain and hidden inflammation. So pain is obvious. People know that they're in pain. They have physical pain from an injury. But inflammation is a little more subtle. Most people that have an inflamed GI tract are not typically aware that that's what's happening. Most people that have an inflamed liver because of environmental toxins are not necessarily aware that that's what's happening. Okay, so you have a lot to work on there. And so when we're looking at the adrenals, it's 3 different things: emotional, dietary, and inflammatory stress. Those are the 3 big ones that we're looking at. So in the model that I like to teach, we're analyzing all the sources of stress in a person's life. I'm not saying that we can fix all of them. We just want to find out what they are. If the problem is an eating disorder, I'm not an eating disorders counselor. I will refer them out. If the problem is that they don't exercise, I'm not a personal trainer. I'm going to refer them out to a trainer so they can start to exercise. So it's our job to find out what these stressors are, but you don't have to be the one that corrects everything. You need to just be the case manager of the overall case, so you make sure that they're going to be attended to properly. So here we have a diagram with cortisol and DHEA in the middle, and then going out to seeing how it affects memory and learning and the bone health and the glucose or carbohydrate metabolism and inflammatory states and detox and metabolism and even other hormone systems like the thyroid and ovarian hormones and insulin. So our stress response is in the middle here, and that is echoing out and impacting everything from your brain to your thyroid to your mitochondria. So stress ends up being a super, super important variable in our overall health. And as part of this, we're just focusing on one aspect of this really today, which is how the stress hormones like cortisol and DHEA relate to the gut. So this is a pathway chart of how they're made. So you can see we make cortisol from cholesterol, interestingly enough. So from cholesterol, we make pregnenolone, and it goes down to cortisol. From cholesterol, we make pregnenolone, and it goes down to DHEA. So the labs that we're going to look at we're testing cortisol and DHEA, but what we're seeing are these, different pathways that you have on the chart there. So the important thing to remember about cortisol, if there's just one thing you remember about it, is that it's catabolic. It's going to encourage the breakdown of things. Now, cortisol is not bad. If you have the right amount of cortisol, it helps with body fat. It helps with mood. It helps with the immune system. It helps with ovarian hormones. It helps, counter allergies and inflammation. It helps resist. It helps us resist stress when cortisol is normal. But when it's in excess, that's when things start to become catabolic. Now we've got tissue breakdown, problems with glucose, insulin resistance, problems with the gut, sex hormone issues. All these things happen when cortisol is in excess. And then the things that stimulate cortisol, well, there's a couple of different ways you can do it. Number one, I think about this, one is that I like my 3 things model, which is, if the patient says, well, why is my cortisol out of balance? Well, there's 3 things: emotional, dietary, and inflammatory stress. That's my favorite one. That was the earlier slide. Emotional, dietary, and inflammatory stress. Those 3 things throw off your cortisol. Now, if you want to get down to the details of it, environmental toxins, the overuse of our cell phones and smartphones. I don't know about you, but I have a smartphone. I literally can't leave the room without this. And if I don't have my smartphone for like 10 minutes, I start to get panicky. I think we're all like that now. We're just addicted to these things, and it's not good for your adrenal hormones. Of course, there could be other problems like recreational drugs, people dealing with a pandemic and all these kinds of things. So here's a schematic about the different stages of adrenal exhaustion. And when we look at the lab test, we're trying to identify what stage the person is in. So like with the gut testing, we had 3 stages. Remember, stage 1, a microbiome, stage 2, organs, stage 3, pathogens. With the adrenals, we also have 3 stages. Stage 1 is high cortisol, stage 2 is cortisol is dropping, and stage 3 is there's low cortisol. Okay, so again, stage 1 is high cortisol, stage 2 is it's dropping, stage 3 is it's low. Oops, sorry, hang on a second here, the wrong button. Sorry about that. Get this back, there you go. So now we're gonna look at in a moment here. I don't have my little pointer thing, but we're gonna look through these labs and see to identify adrenal labs that are stage 1, 2, or 3. And we can talk about protocols to correct for that. And then going back up here, we're going to look for GI labs, and we're going to look at some complicated GI lab test reports. But all you need to figure out in the beginning, is there a stage 1 or 2 or 3 present? Because that's what you're going to treat. So we're going to look at these multi-page labs. With the adrenals, there's many different times of day they test and different hormones they look at and whatnot. With the gut, it's page after page of data, but you really only need to identify, are they a stage 1, 2, or 3 for the gut? And are they a stage 1, 2, or 3 with the adrenals? And then when it comes to treatment, most people, I should say it's very common in functional medicine for people to treat the gut first. However, I was taught 30 years ago, and I still believe this today because I've seen it to be true, that we should start all these programs with the HPA axis or adrenal protocols first and do those programs for a month or 2 before we treat the gut. And why is that? Because the adrenal program will help us deal with strengthening SIG-A, which is the immune response in the gut, and will help us reduce leaky gut and inflammation in the gut, which is going to make the gut program much more successful. And the adrenal programs are also going to encapsulate or include the lifestyle changes, the stress reduction, dietary changes, and exercise and sleep and all these things. So that first month or 2, if you do lifestyle changes and the adrenal programs, you're going to set the person up to be much more likely to be successful to do the gut clearing when you get to it. So again, starting with the adrenal program, but really the adrenal program is preparatory for the gut protocol. You'll find that your gut treatments will be much more successful. The odds that they're going to work will be much higher if you start with the adrenal programs. So most of the adrenal programs last for about 6 months. We start with them for a month or two and then get into the gut treatments as soon as the patient started to make some lifestyle changes and as soon as the patient has started to feel a little bit better. There's one, so I'll tell you one story here. So well, first of all, if you start with the gut programs, you will be successful. I'm not saying that doesn't work, it works, but they almost sometimes work a little too well. And what'll end up happening is the patient will think that it was the supplements that made the difference, the biggest difference. If we start with the lifestyle changes and adrenal programs, it gives the person time to understand that they actually need to eat better, stop alcohol, they need to exercise more or sleep more. And that's the bigger, more important lesson that we're trying to teach. And so if you jump right into gut treatments, you kind of undermine your ability to really help the person understand some of these other variables that are so important. All right, so now I'm going to take a pause for a moment here and show you guys some lab tests. And then you're welcome to ask questions about all these things. So I'll have time for questions at the end. And let me see here. I'm going to pull up a few things. So we want to look at, obviously, some adrenal labs and some gut labs. I just want to make sure you guys can see the labs now on the screen. Is that working? Hopefully. Sometimes when I switch screens on these things, it doesn't really carry over properly. All right, let's see here. Yeah. So here's an adrenal lab. This is from Genova. There's other companies that do these as well, but this is the one that I use in my practice. And these are labs that have been submitted by students in our mentorship program that we've looked at recently. So with the adrenal test, again, from Genova Labs, cortisol stress test, it's measuring for a few different things. It's checking the cortisol awakening response. And this particular person, it was quite high. You can see there it was at 126. That's way too high. It's checking for DHEA. In this person, the DHEA was extremely low. And it's checking the cortisol rhythm over here. And you can see again, in this person, the cortisol rhythm is low in the morning and then high later in the morning and then high at noon. I'm sorry, high in the afternoon and then dropping down at night. So there's got some pretty serious problems here with all aspects of the adrenal glands. So with a program like this, we're trying to determine, are they stage 1, 2, or 3? And the stages are all predicated on the DHEA levels being low. So this person has low DHEA. In this case, if the cortisols are all high, it's a stage 1. If they're dropping, it's a 2. If they're all low, it's a 3. This person's actually kind of a classic stage 2. And we can get into that some other day because it's a little complicated to analyze these. But just to let you know, stage 2 adrenal lab, and that's one that we see frequently. So now, if you look at a GI test here, same patient, this is again a Genova test, GI effects. There's other companies that do these. There's Doctors Data has a GI 360, which is almost identical to this one. And here, they map out what's going on with the gut. And so, as we mentioned earlier, we want to see, is there an organ problem? And you'll see that under maldigestion. And for this patient, you can see pancreatic elastase is low. That's an organ problem. That's what we call stage 2. Is there a microbiome problem? Well, I'll show you. There's a whole page of that here. It's a little complicated. It's really, I'm laughing because it's really complicated. So this is the microbiome analysis right here. You're supposed to learn what each of these organisms is for and how they each interact with one another. It's, you really literally would need to spend 5 or 6 years getting a PhD to understand this one page here. And because this is pretty much impossible for clinicians to understand, they take care of that for us, thankfully, and they summarize that. And by the way, these are the commensal bacteria. I should at least mention their names. Let me not. There's some important ones here. So commensal bacteria by PCR, you can see that at the top. This is the GI microbiome section of the test. So these are the good guys. And there's some really famous good guys here. At the bottom, you'll see Akkermansia. I can make that a little bigger here so you can see that better. Akkermansia muciniphila, Methanobrevibacter smithii, Desulfivibrio piger. I'm trying to list out the Bifidobacterium. Most people have heard of that one. I'm just trying to list out the famous ones here. Um, and so it's nearly impossible to interpret this portion of the test unless you have a computer program running. And fortunately, that's what the lab has. So here you'll see on the lab on page 3, they have the commensal balance. They've taken a summary of all that data on the page I just showed you, and then they put you into good, which is green, or bad, which is red. So you can tell, is the microbiome healthy or not? And again, this is what we call stage 1, right? So the microbiome. Now, a stage 2 is GI organs. And you'll see that on this page. The pancreatic elastase, low, that's a pancreatic enzyme problem. That's an organ issue. That's a stage 2 problem. Eosinophil protein X, high, or calprotectin high, or secretory IgA high. Those are signs of inflammation in the intestinal tract. So that is a problem with the large intestine being damaged or the small intestine being damaged. Leaky gut, or damage or inflammation to the large intestine, right? Small or large intestine, depending on which marker it is. And then here you can see there's an infection category. That's our stage 3. So as you're looking at these labs, you're just trying to sort through, is there a microbiome imbalance? You look at that part of the test. Is there an organ problem? You see, yeah, there's a problem with the pancreas here. Is there an infection? Yes, there's a parasitic infection. And this just gives you an organizational structure so you can start to incorporate what the test means and help patients with it. And then it also frees you up from trying to memorize every single page and what's going on. But here you'll see at the end of the lab, Dientamoeba fragilis and Blastocystis hominis. So they have 2 different parasitic infections. So that's a stage 3. So this patient has problems with their pancreas, some inflammation in the gut, 2 parasitic infections, and the microbiome is okay, but not great. And then you couple that with, or you pair that with, the problems with the adrenals, and you get someone who's sick. If you test and correct the adrenals, do the lifestyle changes plus adrenal supplements, and get the gut corrected, you're going to have a very happy patient in a few months. So for the adrenal treatments, we use blood sugar control products like lipoic acid, chromium, vanadium, biotin, those kinds of things, along with a good quality multi. For the adrenal programs, you can also use adrenal glandulars or adaptogenic herbs. You can use dosages of vitamin C, and of course the B vitamins are very, very important for the adrenals. So there's a whole collection of products you can use to normalize the adrenal hormones along with the lifestyle changes. And then for the gut programs, if there's an infection present, you can use antimicrobials. There's berberine, there's grapefruit seed extract. There's a variety of different things that are antimicrobial, that are herbally based. You can also use repair products when there's problems with the gut lining. That would be products that are based around glutamine or colostrum or things like that. And then to make sure that the gut clearing goes well, this is very important. If you see infections and you're going to work on clearing out the infections, you want to support the liver and the GI system together with some detoxification support, because you're going to be killing these organisms. You want to make sure you support the liver so it can clear them or get rid of them. And that's going to include things like methionine, glutathione, N-acetylcysteine, maybe some of the herbs like silymarin, artichoke, or turmeric, things that help support the liver, things that help support detoxification pathways. So you're clearing things out well. And then some of these are really straightforward. Like if the pancreatic enzymes are low, like on this case, you give pancreatic enzymes. If stomach acid tests that it's low, you give some betaine HCl. If there's the secretory IgA problem, you can give something to support the immune system like colostrum that has IgGs in it. If there's leaky gut or inflamed gut, you can use a glutamine-based powder to correct that. So once you get some training, you can make all this work. When you have a microbiome imbalance, you can use a probiotic, etc. All right, let's look at one more set of labs here. Is that the right one? Oh, here, no, sorry. There we go. So again, with a different patient, you would run an adrenal panel, and here's a GI test. This is a GI effects. Now in this one, you can see we're looking for microbiome first, right? Are they a stage 1 or is there a microbiome problem? So you can just scoot down here to this commensal balance page. You can see clearly there's a problem. They're not in the green, so you know there's a problem. You can look at the page that has a summary of all the organisms just to see. But again, this one's kind of hard to understand until you study this stuff a lot. But I can just point out one or two things on this lab. You can see Akkermansia is low. That's one of the most important bacteria for the gut lining, for maintaining the health of the gut lining. So Akkermansia mucinophila, that's one you really need to know. Most of you maybe have heard about it already. It's named for what it does. So Akkermansia mucin. Mucin is a mucosal layer. Phila or philia is a lover of mucin. So its food supply is the mucosal layer of the gut lining, and it's out there in the gut lining, munching away and eating mucin, and keeping the gut lining from getting inflamed, keeping the gut lining from getting damaged. So it's a very important one. If its Akkermansia is low, as it in this case is, there's going to be a major problem with the mucosal layer of the gut. There's another one on here that's really important. I just want to point out, these are again commensal bacteria, Faecolobacterium prausnitzii. Do you see that one there? Faecolobacteria, Faecolobacterium prausnitzii. That one is extremely important because that one is associated with COVID and long haul COVID. So in patients that don't recover from COVID very well, they can have a problem with this particular bacteria. And one of the things that Faecolobacterium prausnitzii does is it's responsible for making butyrate. And butyrate is a short chain fatty acid. It's produced by gut bacteria like F. prausnitzii. And when butyrate goes to the brain, it triggers the growth of brain cells. And it triggers the growth of new brain cells, and it triggers repair and improve function in existing brain cells. So it turns out butyrate is very important, and this is one of the many gut-brain connections. Faecolobacterium prausnitzii, among others, is responsible for making butyrate. You make the butyrate in the gut with the gut bacteria being responsible for producing it, and then when that butyrate travels to the brain, it stimulates brain growth. So if you get COVID and your F. prausnitzii levels drop, it can have a very big impact on your brain. And I'll just show you here on these tests. They also do measure short chain fatty acids. This person is low in one of these, acetate. Let me see if I can find a better example here. Yeah, here's a good one. So short chain fatty acids, you see how they're low there? And then butyrate. So butyrate is probably the most important of these short chain fatty acids. It's a very powerful anti-inflammatory. It fuels or is a energy supply for the intestinal lining cells. And again, butyrate's made from these good gut bacteria. So if butyrate's low, you're going to have a gut-brain problem. Not enough butyrate in the brain, you're not going to have the stimulation to have healthy brain cells as you would want. And now let's see here if we go with this particular lab. Yeah, so you can see commensal bacteria, again, close to the red zone there. And we go back up here. So there's a problem with dysbiosis with this case, maldigestion. Now this one is flagged for fecal fats. That would imply the gallbladder's not making enough bile. And that's going to cause digestive problems for sure. And then there is some infection present as well as dysbiosis. So this person has a stage 1 in that their microbiome's out of balance, a stage 2 in that their gallbladder's not working, and a stage 3 in that there's dysbiosis and infections present. So you're going to test and correct their adrenals and then start to work on these 3 different stages of correction for the gut. All right. So we can take a peek at one more of these, and then we can take a break and look at questions that you may have. So here's again a gut test from Genova, and we're going to go down to the page that has the commensal bacteria. So in this case, the commensal bacterial markers are good. There's green there, right? And then let's go back up to the top here. Then we're looking for organs. Fecal fats, there's a problem. So there's a little bit of a problem with the gallbladder, but a big problem with infections and dysbiosis. So this person, you would be primarily working on infections. And you could start right away with looking at this stage 3/infection thing. And then I just want to show you one other marker that I mentioned a whole bunch of times, but we'll find it on here. Should be right in here. Oh yeah, here we go. You see where it says fecal secretory IgA? So secretory IgA, its production is regulated and controlled by cortisol. When secretory IgA goes high, it means that the body's responding to some kind of an infection. With a lot of these chronic adrenal cases, you also will see secretory IgA has gone low, meaning they've probably been in a state with infection for a long time, and the body's ability to make this immune response has started to be compromised. Okay, so that's an important marker. And this marker very much is an adrenal marker and is very much a gut marker at the same time. All right, so I'm going to wrap up the talk for the moment. I'm going to let you guys know also, if you're interested in more classes, you can look at the Kalis Institute website. We have all the courses that we're offering listed there.